And welcome to the Dr. Bob Show. How's your thinking? How's your mind? Are you forgetting things? Are you worried about not remembering as well as you should? Could you be getting dementia? What is dementia? Do you have a form or family history of dementia, Alzheimer's disease, Lewy body dementia, vascular dementia, lots of forms of dementia that we're learning about. And now we're going to be spending this show talking about how we can prevent dementia from occurring. My guest is Dr. Monica Crane. Dr. Crane is a board-certified geriatric specialist, and she deals with Alzheimer's and dementia problems every single day. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about stiffness in the neck, what we can do about that, and heart failure. What are some of the causes? And we can prevent those also. A lot of information on this show you'll want to watch. We're talking with Dr. Monica Crane, board certified in geriatric medicine, the clinical director of Genesis Neuroscience, and spends most of her time treating patients that have dementia. Monica Crane has been a guest on our show 3 or 4 times, and she is one of the best teachers that we have. Monica, welcome to the Dr. Bob Show.
Well, thank you for having me back, Dr. Overholt. It's a pleasure.
Now, let's sort of re-go. What is dementia?
So the word dementia isn't actually a diagnosis. It's a category. Just like the word cancer isn't a diagnosis. You have to have a subtype. So I think of the word dementia really as a not very good word for a neurodegenerative disease of the brain. So it's neurodegenerative, degeneration of the nerves, and it's progressive, and it must impact function. Alzheimer's disease is the most common subtype, but there are many other subtypes. So
are we learning more different subtypes?
Yes, we're learning about a lot of other subtypes, even some new subtypes that mimic Alzheimer's disease.
So the study is really advancing quite a bit. We'll talk about some brand new things that are coming out I'm really excited about that we'll talk about on this show today. So how can we prevent dementia from occurring in some people?
We actually think in Alzheimer's disease specifically that about 43% of Alzheimer's cases in the U.S. can be prevented.
43% of Alzheimer's disease in the United States can be prevented. How is that?
Well, we have identified risk factors, and this is the newest study that just came out in 2020. And these risk factors are key. The first one is education.
So education means how much education you get from teachers or from your parents, from your home, from your environment. What do you mean by education?
Specifically, formal education from 0 to age 20 is key, regardless of what you study. So even if you say, wow, that class is useless, well, guess what? You're building redundant pathways. Think of it like extra side roads, so just in case the highway breaks down, you still have other pathways in your brain.
You know, and I'm amazed when you talk about education that way, what you can pull back from the brain on things that you learned a long time ago, on events that happened. They're there and you don't think about it, but when you search your brain, you can pull that information back. So that has to do, how do you develop education? Make sure people go to school?
Well, I think the focus is going to be on early education specifically. So that preschool level is really important for the developing brain.
So when you develop the brain preschool, that decreases the chances that you'll get dementia, Alzheimer's disease, and can prevent it even.
Yes, later in life. But I think some of the other risk factors, I mean, that's a tough one to change if you missed on that opportunity. There are other risk factors that you can change later in life.
What are some of the other risk factors?
I think one of the most exciting ones is hearing loss.
Yeah, I'd heard about that. Tell me about why hearing loss is related to Alzheimer's.
So we think hearing loss stresses the brain. So imagine you have decreased information going into your ear, and it causes some sort of neuronal stress, meaning you're not getting enough input. And so correcting hearing loss actually mitigates this risk. So even if you have hearing loss, get those hearing aids, wear them. And even if you don't like what you hear, it's good for your brain.
You know, and getting hearing aids is something that my wife challenged me on sometimes. So, Bob, you're not really listening very well. You know, and when you think about it, when you think about your hearing and you think about the excitement that comes to your ears from the outside, noises, birds singing, water, rain, noises, television, all this really stimulates the brain a great deal. Is that stimulation what helps prevent Alzheimer's?
We think that that stimulation is key. Just like we need cognitive activity, mental stimulation, we also need stimulation for our eyes and our ears.
Okay, so we've got early education. That's very, very important. Being sure that our hearing is adequate, good, and protected, and hearing aids help part of that.
Hearing aids actually reverse that risk factor.
Yeah, I think that's, so if your hearing is down and you get the hearing aids and you wear them, you reverse that factor.
Yes. Another risk factor that is newer is treating hypertension or high blood pressure, but treating more aggressively than we thought. The goal is less than 130 for that top number, or systolic blood pressure.
And so why do we think that high blood pressure has something to do with brain activity?
We think that elevated blood pressure increases some of the vascular damage in the brain, and just little microscopic damage contributes to the Alzheimer's pathway. So this idea of, well, you know, maybe I've had blood pressure problems for forever, let's let it be. Oh, I always get white coat hypertension. Well, I tell patients that means your blood pressure is spiking every time you're a little stressed. So imagine most of us have a couple little stressful moments through the day, and if we don't treat those stressful blood pressures, then we're going to have a problem later on.
Yeah, and the problems that we get with high blood pressure can be dementia, can be Alzheimer's disease, as well as heart failure, heart attacks, strokes, kidney disease. And so hypertension is something so easy to control because you just measure your blood pressure, and if it's elevated, you treat it. And there are excellent medications. Another risk factor.
Traumatic brain injury, that is a brand new risk factor. We've always known that it does contribute, but this one is specific, and specific to patients that are actually a little younger, not just in their youth, but even that period between age 40 and 65, traumatic brain injury appears to be really key in propelling someone into Alzheimer's.
Are there certain types of traumatic brain injury that we can prevent more easily, like athletics, football? We wear helmets so we don't get head injuries, but that just means we wear helmets because we're going to get our head hit. Are there other activities that seem to create problems as far as trauma to the brain?
Well, I think that we have to be cautious, particularly when bicycling, to make sure we're wearing our helmet. Any sort of activity where you can wear a helmet, do so. And of course, think about crashing your head into anything, whether it be football or another sport. For instance, even with a great helmet, the amount of force that occurs when, let's say, two big football players crash into one another is about 50 Gs, 50 times the force of gravity. It's pretty extreme pressures that we're exerting on our brain. So the whole idea is trying to minimize the number of times we bang our head around.
Education, hearing, blood pressure, trauma to the brain, another one.
Obesity. and specifically obesity between age 40 and 65. Apparently, this is the magic window in which we should behave.
So from 40 to 60, it's when we give all sorts of excuses as to why we're gaining weight, and we do gain weight at that time.
Yes, we do gain weight.
So it's important that we keep it right. Are there other risk factors that we have that we can change?
There are some when we're just a little older, too.
And that's what we're going to be talking about when we come back. What are some of the other risk factors that you and I can take care of? We can take care of our hypertension. We can take care of our education. We can take care of trauma to the head. So what other things can we take care of to prevent you and I from getting dementia later on in life? We're talking with Dr. Monica Crane, board certified in geriatric medicine, the clinical director of Genesis Neuroscience. We're talking about dementia, forms of dementia, Alzheimer's disease, and other forms, and the treatment of those, and the prevention of those. And the exciting thing is, we've learned we can prevent Alzheimer's from occurring. Early education, control of high blood pressure. So get your blood pressure taken at an early age. Know that education is so important. Watching obesity. There are other risk factors that I want to talk about also. What are some of the other? I forgot to mention hearing. That's one of the big things. Very, very important. What are some other risk factors?
I think one of the biggest risk factors and the most interesting one is that smoking cessation in age 65 or older is extraordinarily beneficial, meaning that even if you've smoked your entire life, that quitting in your 60s, 70s, 80s, 90s will buy you time. We think that it buys you quite a bit, the number of years, in fact.
You know, smoking is involved with really vascular problems. It really is very harmful to the vascular system, to the arteries that are supplying blood to the brain. Do you think that might be one of the reasons?
I think that's part of it. I think it's causing inflammation in the brain as well.
And so if we stop smoking, we can preserve the development of Alzheimer's. So that's another. How about alcohol use?
Oh, alcohol is a big one. No one's going to like hearing this, but the amount that's protective is a bit smaller than we thought. So in this article, they referred to 14 units a week. And you might say, well, that sounds like 14 drinks. Well, in fact, that is the European way of converting alcohol. And for instance, like a glass of wine might be 1.5 to 2 units. So it's likely less than 1 serving a day. So
smoking, excess drinking of alcoholic beverages, and that really means less than you think. So we need to be thinking about drinking less, about stopping smoking completely. How about physical activity?
So physical activity is imperative, but in those age 65 and older, even more so. So that was fascinating to learn that even if you've been a couch potato, get off the couch. Even if you're in your 70s or 80s or 90s, it is never too late to exercise. And I think that's what the study really implied, that you can slow Alzheimer's by starting in your 60s, 70s, 80s. And the amount that's beneficial is greater than 3 times a week, ideally greater than 150 minutes. So I say 30 minutes a day. Walking is fabulous. You don't have to do anything fancy.
Yeah, it can be right outside your house. You just put your tennis shoes on and you go for a walk. I always tell people it's better to get a friend that you walk with, because that encourages you to walk together and you can talk and you can socialize at the same time. Is socialization important in preserving brain activity?
Yes, and being social in later life, again, age 65 and older, is the most important time to be social. So it's not in our youth having fun going to parties, it's actually when we are older. And we think that it provides a cognitive exercise. So believe it or not, interacting with other human beings is a brain exercise.
So Monica, in a way you're blowing my mind by all these things that we can do to prevent Alzheimer's from occurring. And when I'm using the word Alzheimer's, I'm using other forms of dementia also. Let's talk about treatment, because there's so many new things that are coming out in treatment. If somebody gets the diagnosis of dementia, of Alzheimer's disease, or a form of dementia, how do you decide what medicines to use and what do the medicines do?
So in terms of how do we decide what form of dementia someone has, we have to do a history. The meat of everything is in the history, listening to your patients. What are your first symptoms? Then doing a physical exam, a neurologic exam, as well as cognitive testing. So looking at different domains of impairment. So are you having problems with word finding and aphasia? Are you having problems with executive function, like doing tasks? Are you having problems with orientation, the where am I? So we ask those kinds of questions. You may be familiar with the mini mental status exam, the MMSE, or a clock draw, drawing the face of a clock, something that sounds simple, but it tells us a lot about how the brain's working.
And so when you take a good history, you can begin to differentiate the different types of dementia that occur, and that will determine what kind of medicines that you give. Give me an example of a medicine that's good for
So there are multiple medicines that are FDA approved, medications that are in this family called cholinesterase inhibitors. Basically, they effectively maintain or increase acetylcholine. There are 3 medications: donepezil, rivastigmine, and galantamine. So they're all very similar, but they're not the same drug, just like you can have blood pressures that are very similar in the same class, but they're slightly different, and each of those is ever so slightly different.
Do you ever use them in pairs? And if one doesn't work, you automatically go to the other? Tell me how you coordinate the medicines.
So in that class of drugs, we usually only use one. There is another drug called memantine, which works at the level of the glutamate receptors, and memantine works really nicely in conjunction with those other 3 medications. Think of it as being synergistic. Together they work better than one alone.
So when you put somebody on 2 medications, what can you see? How easy is it to see the improvement? Is it what people tell you or what you see when you retake the history?
So we'll retake a history, we'll do repeat cognitive testing, and many times it is nuanced. Remember, cognition, all of thinking, all of the brain is a lot more complicated than one little test. But what we see is a slowing of decline. And remember, if you can buy yourself time, a lot of us could tolerate a little bit of memory loss if we're still able to function in life.
When you're giving people medications for dementia, what do you see in that family? What I'm trying to pull out here would be stories of people that just a little bit of improvement really changes their life and changes the people around them, makes life more fun, more exciting. It must be a tremendous thing to see people improve on these medicines.
Absolutely. And remember, small improvements are huge. If you recognize your loved one, that can be life-changing. If you know that you're in your own home, that is life-changing. So I try to say to people, these medicines don't stop working. You shouldn't just take them for a year and then quit. The gains may be smaller, but still big to you.
Yeah, and it made me recall the time where so-and-so just doesn't remember me. You know, they didn't remember who I was when I went to visit them. And then the next time they may be doing that because of the medicines you get. And that just changes everybody's feel of supporting that life and having fun and enjoying mom and dad or whoever it was that was getting the problem. Let's talk about how we make the diagnosis. I'm thinking about biomarkers. What's a biomarker?
So a biomarker is a biological marker. We use a biomarker every day. The blood pressure cuff, the scale, it tells us something about disease, and it has to be objective. The types of biomarkers we use in Alzheimer's disease include brain imaging, spinal fluid analysis, and hopefully a blood test.
So is there a blood test that you can see in the future that will help us know if we're getting Alzheimer's or if we're getting a form of dementia?
There is a test that is being studied right now that looks at phosphorylated tau, a fancy way of saying that there's a protein in the brain that's clumping up abnormally, and we can measure it in the blood.
It's getting more and more and more advanced, and more makes us feel better about the ability to treat people. Is there any vaccination in the future that you're thinking of in people with Alzheimer's?
I am so glad that you brought this up.
And that's what we're going to be talking about, because that's the new thing I wanted to bring out on this show is there a vaccination for Alzheimer's? There may well be. It may be the most exciting thing that's going to happen in American medicine in the next 5 years. We're talking with Dr. Monica Crane, board-certified geriatric medicine, clinical director of Genesis Neuroscience, and we're talking about we can actually prevent forms of dementia, Alzheimer's disease. We can prevent that by modifying our lifestyles, early education, control of our blood pressure, control of our weight, our hearing, making sure that our hearing is proper. If we need hearing aids, get them, use them, and you can prevent the development of Alzheimer's. And then we've talked about medications that we can use to improve the activity of the mind. And then we came to there's something brand new out. So let's talk about if there is a type of vaccination that could help get rid or prevent or not allow Alzheimer's to occur. What would that be? Is that available?
So the great news for your viewers is that Alzheimer's disease may be curable.
Alzheimer's disease may be curable. You've heard it here on the Dr. Bob Show. How is that?
So there's a drug that's under FDA review. We don't know for certain if it will be approved, but there are several others that are also being studied. And it's a vaccination against the plaque in Alzheimer's disease. It's what we call a monoclonal antibody that sends a signal to the brain to get rid of the plaque.
So is this administered by shots in the arm or by intravenous or pills? How's the medicine delivered?
It's an intravenous medication, and it has to be given more than once. So it's given monthly. Some of the other trials are twice-a-month drugs. But the promise is that if you are in the mildest stages, now that's key, you have to be in the mild cognitive impairment stage to benefit.
So is that why it's so important to find people early that are having dementia early?
Yes. So the key is think of the word cancer, and if we waited until someone had metastatic disease, it'd be very hard to cure those. But we screen for cancer and we cure it when we screen and find an early stage. The same idea goes for Alzheimer's disease. Eventually we'll get to the point where we're screening universally, detecting disease very early, and then immunizing people.
So detecting the problems that we have with our thinking, with our memory, with dementia that people have, we're going to find that earlier, see who's the candidate, and we'll be able to vaccinate where it will make it go away. It won't occur. It'll stop. It's cured.
So it pulls plaque out of the brain. And it doesn't mean it's guaranteed for life, but if you can halt a disease by 5 or 10 years, that's an effective cure.
And that's so exciting. You know, I think as we look at the overview of this show, there's things that we can do that will prevent it. And now if we find it early, we can make it where it's cured, where it's not going to even develop at all. And so it's amazing the different advances that occur. How do we make early diagnosis?
So the key is if you or your loved one are concerned, go ahead and see your primary care doctor, get screened, talk to your doctor about your symptoms. We used to dismiss it as the worried well, but we know that individuals can detect their own symptoms called subjective cognitive impairment, meaning you can't see it, but you know something's not quite right. And this is not just forgetting names. We all forget names. We all have difficulties finding a word here and there, but eventually they come to us. In subjective cognitive impairment, individuals say, I'm not remembering even when given enough time.
Wow, and so I've forgotten something and can't even remember it like that. Is that easy for the doctor who delves into the history carefully? Can you find out that subjective event?
Well, a lot of times on a simple screening, it doesn't show up. It takes a lot more of an evaluation and additional testing, additional biomarkers, additional imaging. We do have a scan called an amyloid scan that actually marks plaque in the brain. So the other fundamental problem is, yes, we have all of these special tools. Some of them are approved but not covered. And then lastly, the best way to diagnose is autopsy. That is a terrible way to diagnose any illness.
You know, Monica Crane, you've taught us that we can prevent Alzheimer's disease. There are certain activities that we have to watch after as far as our health goes. And now we've got a vaccination in the future that we can look forward to. Thank you so much for coming.
Thank you.
And while we're talking about that, remember those 4 things that we like to do. Number 1, it's exercise. Be sure you're exercising. It'll help you prevent getting Alzheimer's disease. Make it at least 30 minutes and make it 5, 6, 7 times a week. Eat properly. There are foods that will help the brain and help the brain function better. Sleep hygiene, sleeping properly, getting 7.5 hours of sleep every single night. So you have to know when you go to bed, and you know when you're going to wake up. If you're not sleeping well, then talk to your doctor about it. And most of all, what is it we like at the Dr. Bob Show? It's that laughter in your life. You can laugh a lot more knowing that Alzheimer's may be curable for you and for me in the future.